Hello, my name is Alera. I am currently a psych tech at the Evaluation and Treatment Center here in Mukilteo. We are an involuntary psychiatric unit. I started here as a psych tech 2 years ago, and then I transitioned into being a court liaison for a period of time, going over court documents and requesting records and stuff like that. And then I transitioned into being a clinician and doing discharge planning. And then I decided I wanted to go back to school, and psych tech role kind of fit that schedule better, so I came back to being a psych tech. Okay, my typical day here at the ENT consists of coming in, getting report, and then I just kind of try to have a feel for the unit. Sometimes it's hard in the mornings because a lot of our patients like to sleep in. And then we kind of look at what we have to do for the day. Some of us are in charge of meals and some of us are in charge of vitals. And so we kind of just get that done before we do our morning med pass. And the day kind of goes from there. It can vary day to day. It depends on what kind of patients we have and if they're wanting to play games or do groups or watch a movie, or if, things are a little bit more heightened on the unit. It really varies day to day. What I love the most about our program is that we get to see people through various stages of crisis and then seeing them stabilize and go out into the community. Especially for me sometimes, since I also work at Aurora House, I get to see patients who we stabilized here go to Aurora House and kind of continue that road of recovery. And so I think that's really beautiful to see. And one thing that I always think about when working in this facility and kind of mental health in general is when we imagine someone being in crisis or being sick and hospitalized, you usually see a lot of family come and try to support that person. But with mental health, it's not really the same just because of the impact that it has on the family, sometimes a negative impact. And so our patients don't receive that same level of support as someone who's hospitalized for liver disease or something in the medical field. And so it's really rewarding to be that support system for them. And a lot of the times, we'll hear patients be very grateful for having us there through this time. So that's a really special thing to be a part of. One stigma that I would change in mental health would have to be the stigma that exists about psychiatric patients in the healthcare system in general. I think a lot of medical providers are scared of psych patients, and that makes it very difficult for them to receive healthcare services that they need. For example, I myself am in a nursing program, and when I tell nurses that I'm going into the psychiatric field, I get a wide variety of responses. And I think that's because there's this misconception of psych patients being violent and unruly, and that's just not really the case. My go-to mental health trick or technique is to allow yourself grace. I think sometimes when we talk about self-care, we talk about good things like yoga or running, but sometimes you just need to sit in a room and scream at the top of your lungs, and I think that's also okay. So I just say allow yourself a crash out every now and then. In 5 years, I see myself working as either a nurse or a nurse practitioner here at Compass Health. The whole reason I went into nursing is because I saw the provider shortage that exists, especially for the clients that we treat with really difficult diagnoses like schizophrenia or bipolar disorder. And so I would really like to bridge that gap, and so I hope to be that person in 5 years. One thing that I wish that the community knew more about Compass Health is that we are here and we exist. I think a lot of people don't know about Compass Health or the services that we offer, so I wish it was more widely known about. I really think that the way that we work with clients and their support systems and really put in the effort to find the discharge plan for them to succeed in the community is very unique, and I would hope for other mental health facilities like us to adopt that same approach so that we're able to kind of make sure that not just the patients that we see, but psychiatric patients in general are receiving the care that they really deserve.